Hi there, Bethany. How are you today?
Hi, I'm doing well. How are you?
I'm doing well as well. Ready to answer some questions?
Yes.
Okay, we'll start with your name
I'm Bethany Evans.
and what you do for us here at Benefis.
I am a family nurse practitioner.
And have you completed any special training?
I have. Actually just completed the family medicine residency, which allowed me to follow with multiple specialties across Benefis campus and also learn how to better treat family medicine patients.
What led you to medicine in the first place?
I was a registered nurse on the intensive care unit through the COVID pandemic, and it was just very evident that so many people did not have primary care. A lot of preventative medicine was lacking. A lot of diagnoses were not made ahead of time. So people didn't know that they had some illness going on. And COVID really exacerbated some of those disease processes. And if they would have had a primary care provider, it may have been caught earlier and been more well managed. They may have been more up to date on their screenings, vaccinations, and things like that that could have kept them healthy. And so that was kind of the driving point that made me realize that now's a good time to pursue the dream I always had of working in preventative care.
What do you wish patients already knew before they came to see you?
I wish they knew that I am ready to meet them where they are. I don't want them to be anxious, nervous, or, worried that I'm going to judge them for something that they're doing that isn't necessarily healthy. I will meet you where you are and we'll come up with a plan that works for you and can support your health in the best way.
What are some common medical misconceptions that you see being spread around?
I think this one is as basic as dietary needs. I think carbs get a lot of heat for, being bad for you. But the reality is carbs are the body's preferred nutrition source. They are so essential for living a healthy life. I think quality matters more than anything else. So make sure that you're trying to get as much whole grains as possible and really make sure you're getting enough fiber with the carbs. And that can help your body use them more efficiently and be healthier.
What's your favorite thing about your job?
I love the broad spectrum of things I get to see. I love caring for kids all the way through elderly patients. And with it not being a very specific specialty, we get to see a broad ranges of problems and diagnosis, and it's never boring. And we just get to keep up on a lot of skills and a lot of evidence-based medicine that's very broad and not necessarily so specific. So I'm never bored.
What's your favorite thing about working at Benefis?
I love how much of a team atmosphere Benefis has. From all specialties that I've rotated with, everybody has been so accommodating, from the support staff to nurses to advanced practice providers and physicians. Everybody has always been willing to teach, been willing to support us. And everybody seems to be so focused on patient care and always keep the patient's best interest in mind. And that's very important to me and one of my favorite things.
Well, we really appreciate you taking the time to speak with us.
Yes, you're welcome. Thank you.